we discussed how air moved through the nasal cavity, past the conchae, down the pharynx, past the larynx, through the trachea, the bronchi, the bronchioles, and then into the alveoli. However, in order to do that, what we need to do is we need to make a way for air to come in to the chest when we're breathing in and go out when we're breathing out. And to understand that, you're going to have to understand some basic physics. Here I have a simulation of gases in a chamber, and what I'm going to do is I'm going to add gas to this chamber. When I add gas to the chamber, the molecules are going to collide with the walls of the chamber, and you'll notice that the pressure goes up. The number of collisions is actually proportional to how much that pressure raises, which means if I add more molecules, I'm going to have more collisions, and as a result, my pressure is going to get a little bit higher. Now, if I change the size of my gas container by shrinking it down, the pressure is going to increase because in a smaller container, the same amount of gas is going to collide even more. And so that's going to lead to more pressure. If I increase the volume of my container, the pressure is going to go down because now those molecules have more room to run around. They're not bumping into each other or the walls, and that's going to translate to less pressure. So the way that we talk about this relationship is we say P1 V1 equals P2 V2. This means if we don't add any air to the system, if we do something like we did here where we change the volume, so I made the volume bigger, then the pressure has to go down in order to make this equal what it did beforehand. Conversely, what you saw in the simulation is when I decreased the volume, the pressure went up. And this again would get it to equal the value over here. Now, when we think about gases, gases like everything else like to go from high pressure to low pressure. So if we have high pressure gas over here and low pressure gas over here, the gas is going to move this way. Okay, so let's think about this in terms of your breathing. If this box was your chest at rest, when you breathe in, your diaphragm pushes downward and your external intercostals pull your ribs outward and upward. So what that means is as you're taking a breath, your chest cavity is going to get larger. Now remember, we said as we increase the volume, we need to decrease pressure, or we get a decrease in pressure. What this decrease in pressure does, if we think in terms of a whole body, is now air is going to get sucked in through your nose and mouth into your lungs because now this air is at lower pressure than the air outside of your body. And that's what causes that air to come in. It's actually sort of sucking in because of a negative pressure relationship. And if you were, let's pretend in space or something, and there was lower pressure outside of your body, it wouldn't work that way, and then the air would get sucked out of your lungs. So when we think about you breathing out, what's going to happen is your chest is going to go from this larger state. Now that diaphragm is going to relax back to its initial position and your ribs are going to relax. And when that happens, now your chest is going to go back to its original size. Since we have decreased the volume, we've increased the pressure. Now the pressure inside your chest is higher than it was outside because you've made it a smaller area. And what this is going to do is cause the air to move to where it's at a lower pressure, which is outside. This is completely passive. When you breathe out, you're just relaxing all those muscles and they're causing the chest cavity to decrease its volume, and that air is going to come out. You can contract the muscles. So let's pretend if you were to be running and you wanted to breathe out really hard, those muscles attached to your ribs, so the muscles here on the walls, those can be controlled. And what they're going to do is push a little bit harder, and that's going to make the pressure a little bit higher and cause the air to come out faster. I want to go back to our simulation for a second, and I want to point something out. And that's that these gas molecules will expand to fill their space. And what I mean by that is that there's sort of some, I like to think of it like molecular manspreading. Basically, the molecules are going to be spreading out so that they take up whatever space that they are given. What this means in terms of air is in terms of gases, is it means that we can decrease the volume and gases are compressible. We can make the same amount of gas fit into a smaller space. This is not true of fluids. If you were to take a glass of water and put a huge amount of pressure on it, it's not going to change the size of the water in the glass because those molecules are already really, really, really close together. So surrounding your lungs, you have a membrane. And this membrane is called the pleural sac, and I always joke that you know it's the one that's around the lungs because you've got two lungs, so they're pleural. Or you can say pleura. This is filled with serous fluid. Now, serous fluid you learned about in the first semester that it reduces friction in things that are moving. And that's just because it's kind of oily. But in your lungs, it has this additional cool function. Part of that is as the chest cavity is expanding, it's going to pull on this pleural sac. And the pleural sac the fluid in the pleural sac doesn't compress like a gas does. So what that means is that it's going to pull on the lung side of the pleural sac. And that pulling creates a great suction for air to come into the lungs. But something else happens too. When you go to breathe out and your chest cavity decreases in volume, that pleural sac still exerts some pressure on the lungs, pulling on them a little bit. What this does for your lungs is it keeps them from collapsing. And you don't want your lungs to collapse because if they were to collapse, the lung tissue would kind of stick together. It's sort of like if you've ever put your hand into a wet glove or wet rubber lab glove. If you put your hand in that wet glove, it's really hard because the fingers stick together. The same thing would happen to your lungs. That lung tissue would stick together because of the surface tension caused by the water in the lungs. And that would keep you from being able to breathe in. So in the case of pleura, it has this additional function of enabling more suction because, again, since the water in the chest cavity can't expand, that means that the only expansion in the chest cavity can come from the lung. And so that really makes it so that all of that pressure that's expanding the chest cavity is going to filling those lungs. It makes them very efficient. And it keeps the lungs from collapsing by always pulling on them a little bit. Now, there are problems that can happen with the pleura. One example of those is you can get a pneumothorax, which would be a hole in the lung, and now you've got air going into your pleura. That means the pleura is going to pull less efficiently on the lung. Over time, as this air leaks into the pleural area, it's going to decrease the amount of space that the lung has, and that's going to start to collapse the lung. This is the thing that you often see in TV shows where someone will jam a pen or a straw into the chest of someone who can't breathe, and it lets off air, and all of a sudden they're able to breathe. What they're doing is they're getting that air out of the pleural cavity. Similarly, there's another pathology called a pleural effusion, and in a pleural effusion you get a buildup of pleural fluid around one of the lungs. Since you've got a buildup of fluid around the lung inside of that pleura, the lung is still not able to expand to the same amount as it was before. And in order to help this person, you would need to drain off that extra fluid. Talk about pathology, it's also important to talk about the trachea and the bronchi. And I want you to think about, if you were, we talked about straws when we were talking about blood vessels. If you're drinking out of a large straw, that's very, very easy because the friction that's pulling the molecules back only happens along the walls of that straw. So the more molecules that you have that are in contact with the walls, the more friction or resistance to flow there's going to be. If we make that straw bigger, now we've got this huge area where molecules can travel without bumping into walls at all. So they're going to be able to flow very easily. The same thing happens with air. If you, and you could probably play around with some straws and breathe through them and feel this for yourself, but if those airways are dilated, they're big, then that means it's very easy for the air to flow in and out of them. When those airways are constricted, it makes it very hard for the air to flow through them. So we've got a couple pathologies that do this. There's bronchitis, which is a swelling in the bronchi. Asthma, which is a constriction that occurs in the airways. Make it harder for the air to get in because those airways would be much more tight. If you're coughing, this can be beneficial. When you cough, you constrict your airway, and that increases the amount of pressure that the air moving upward from your lungs has, and that allows you to dislodge whatever molecule made you cough. So if you got like a little bit of water in your throat, that allows you to push that water out with greater force because now you're pushing the same amount of air through a smaller volume space.